Okay.
Hi there, my name is Dylan and I'm going to be your student nurse today. Can you tell me your name and your date of birth?
Betty Morris, 9/27/1953.
Okay, I see on your chart it's Betty Morris, 9/27/1953. Can I see your wristband?
Yes.
Thank you. And your wristband is 9/27/1953. Do you have any allergies, Betty?
Yes, augmentin.
Okay, yep, and I see augment on your chart as well. All right, so we're going to scan that wristband in. Okay, you're scanned on in. So first off, I'm gonna see what you're getting for medication this morning. It shows that you are getting Fendolin, and it is gonna be an intramuscular injection. You're gonna get in your ventral gluteal, 5 milligrams, 1 milligram over 5 mils. So first off, we're gonna be just going through all three of your sites just to get an idea and all that, let you know. All right, so first off, we're gonna look at your deltoid site. So I'm gonna put 3 to 4 fingers below the cranium process, my pinky finger at the head of it, and my pointer finger. I feel your deltoid site right here. All right, so that's your deltoid. Next, we're gonna go to your vastus lateralis. And put my hand at the greater trochanter, head of the greater trochanter. I'm gonna put my fingers together like this, and I feel in the middle, this is the site, right here where my thumbs are at. All right, so that's your vastus lateralis. And then lastly, your ventral gluteal, which that's the site we're actually gonna be doing today. So I'm just gonna put a pillow right here, because this is where we're gonna be getting the site, getting the injection. So I'm gonna put my hand right here at the head of the greater trochanter, and I swipe my fingers apart, my pointer and my middle, and I feel it right there in the middle of my pointer and my middle finger. It's your ventral gluteal. All right, so now we are going to be, so I'm just gonna leave you like that. I'll cover you back up for now until we give you medication. But let's get all your supplies ready. So we are going to be getting the medication ready, which is going to be phentodoin and 1 milligram, 0.5 mils, which is what we're getting today. And I'm going to get a 3 mil syringe ready. And usually we would be giving a 1.5 needle, but today we do not have that in this bin. So we're going to be using a 1 inch for the injection needle. And then for the safety needle, we'll be using an 18 gauge needle. So first off, let's get some swabs ready, because I'm going to be cleaning the vial for 15 seconds. But for the sake of the video, we'll just do it about 5 seconds in a circular motion. All right, I cleaned that. Let's get your syringe out. Throw that away. And I'm going to be attaching to the 18 gauge safety needle first, because this is what we're going to be getting your medication out of. All right, I'm gonna so the medication is 5 milligrams and dispensed at 1 milligram per 0.5 mils. So I did my medication calculation in the beginning. That would be 2.5 mils. So we're gonna be getting 2.5 mils of air right away. All right, 2.5 mils of air. We're gonna shimmy this off. All right, we're gonna be injecting. I'm gonna get the air out of there. All right, so now I'm going to be getting 2.5, make sure the nose air. Now 2.5 mils of liquid. Do that. There's some air still in there. There we go. Much better. Okay. 2.5 mils of your medication. All right. And now I'm gonna put it down. Make sure that there's no bubbles. No bubbles, I don't see any at all, and there's 2.5 mils. All right, so for the video, I'm gonna be putting the medication back in here, back into the vial. Put this back on. I'm gonna put this into the biohazard bin. And I'm going to be getting 2.5 mils of air. Ready. And I'm gonna attach it to this. So for your second check, I got 2.5 milligrams of medication for you, which I'm comparing that to the MAR, and it is of Phentoin, 1 gram over 0.5 mils. All right. And now for the third and final check, I'm gonna be scanning that in. So 1 milligram over 0.5 mils. All right, we'll leave that there for now, and I will chart that when we are done with this, when I'm done giving the medication to you. All right, so now I'm gonna put some gloves on first. And I'm gonna swipe my alcohol swab on the area that you're getting the medication and chart it. Get a Band-Aid ready just in case. All right, I'm just gonna be lifting this up now, your gown. All right, so I'm gonna put my finger there and at the greater trochanter, and I feel the spot right there. So I'm going to be alcohol swabbing in a circular motion, in and out, about 10 seconds. We'll do it longer, of course, in a regular scenario, but for the video. All right, so I'm gonna have the swab pointing at the site. Alrighty. Betty, do you need anything when you get this medication, like for if you have trouble?
No, I'm okay.
All right, perfect. All right, so I'm gonna be doing the Z-track method, and I'm going to be injecting. I'm gonna be aspirating to see if there's any blood. No blood. All right, I'm gonna be going in about 25 seconds since it's 2.5 mils, but for the video we'll go faster. All right. How does that feel, Betty?
Good.
Good? And I don't see any blood, but we'll put some gauze on there for just a second. Well, I don't see any bleeding, so we'll take the alcohol swab off and just contaminate that area. All right, I will get rid of this and all my supplies. And we did that in the left ventrogluteal site, and we gave 5 milligrams today. Location in the left ventrogluteal site. And in the note comments, I will put it was 2.5 mils, the med calculation. All right. All right, I'm just gonna do some hand hygiene, Betty. And I scanned your medication in. And I dispense of all the needles. Here's your call light, Betty. Is there anything else I can do for you today?
No, I'm okay.
No? All right, good. Thank you.